morning to you and welcome.
Good morning.
Now, this sounds like very worrying statistics. Would you agree with that?
Definitely. Hence, we felt as Gauteng Department of Health that, look, we need to caution members of the community to work with us. Assist where we see, people selling this poison. Just assist us when we interact with the municipalities, when they enforce, the law, that is law enforcement. They need to assist, confiscate, this red poison, because surely it is detriment to our nation and we don't need it actually.
Why is rat poison the notorious choice here, you think?
Look, there's this thing that this poison, it's quick to kill anyone, but we have learned that, look, it's a myth, because one will be bleeding excessively, and all of them, majority, they will be attended by our health, professionals. They will be taken to hospitals or even community health centers. So one will not die instantly. And as such, those that they survive, there's a possibility of, one experiencing, what we call a psychosis, which there's a mental, health, issues which will be detriment to one functioning, and it will need one to be on a continuous basis attended by our health professionals. So it's myth that you will be killed by this red poison. It takes time to work on you and you will be suffering, and members of the family will also be experiencing this challenge that you are in hospital. And like, for instance, we are saying Begimlangeni for this year, 40 cases have been, addressed or attended to. So it tells you that moving forward, we might be coming next year to report, a huge number. So hence we are saying members of the public must assist us to discourage anyone who want to utilize a rat poison to attempt suicide.
Where do people buy this rat poison? Is it normal shops, or where do they get it from?
It's an illegal poison that is available on the streets. And we are saying, hence, members of the community need to assist us to report. It must be confiscated. When the municipal metropolis, they enforce the bylaws, they need to confiscate this poison, because we really don't need this kind of a poison on our streets.
Why do you think is there a spike in these type of cases?
Look, it's a social challenge, I think, something that we're not sure why is it we're having now this kind of figures that are escalating unnecessarily. So hence we are saying it's a challenge which needs people to be cautioned. People need to know that we don't need this kind of incidents, because these are the things that overburden our health facilities. Like, for instance, if we were to attend 40 people at Begimlangeni, meanwhile there are other ailments that we should be attending to. Our health professionals pressurized, and that's where we think this is a challenge for us.
What contingency plans do you have as the department in place in order to deal with this scourge and to save people's lives?
Look, in all our facilities, our health professionals, they know that primary is to save lives. So in an event of any emergency, our health professionals, they are well equipped, they know on what to do. All the people who arrive as an emergency, they are prioritized. You attend to them first, and hence when we get an opportunity to interact with our health professionals, we put an emphasis that, look, we are here to save lives, the rest will follow. What is important is our patient. We need to take care of our patients and save lives, and even if we know that the chances of survival when you've consumed this poison are quite minimal. And if you are saved, you will then have to, on a continuous basis, be attended to again in our facilities, be taken care of, and make sure that your well-being is taken care of.
Yeah. Now, for those at home who has perhaps taken poison accidentally, not those that want to commit suicide, what do the people at home, what should they do to take care of this particular person? First thing that they should do.
Look, the first thing that must happen, they must quickly take that person to our health facilities, because at home they would not have, they would not be empowered to can assist a patient. And we'll encourage them to, as quickly as they can, they need to rush that person to the hospital, and so that our health professionals can immediately attend to the patient, because like as I said, chances of survival are minimal, but our health professionals, if they were quick, that person can be saved.
Steve, your advice to the community out there, what should they do?
Look, in the event they see this poison being sold, they need to report to the authorities, and it must be confiscated. It must be taken away from all those that are selling it, because it's illegal. Anything that is illegal that is sold on our streets, it must be confiscated. So they must work with us, report to the authorities, and we're working very close with the municipalities. We're also going to, in our meetings, to put an emphasis that they must respond when they are called and confiscate this poison, so that we save lives.
Is there an 0800 number that they can call in order to report these people that selling this illegal poison?
Look,
or should they just call the police?
Let them call the police. It will work very easy for them, so that they can then attend to what they're supposed to do.
Well, there's also an 0800 number, 567 562, that you can call, as well as a 0800 121314 number that you can call if you have, that's a suicide emergency number for people that would need that help. There's also an SMS line, the suicide SMS line, 31393. You see it on your screen right now. Mr. Mabona, thank you so much for joining us here in studio.
Thank you.